So this is what Olmsted syndrome looks like.
Olmsted syndrome is also known as mutilating palmoplantar keratoderma.
Walking on my feet is extremely painful. It's like rocks are in my shoes. So that's why I crawl a lot.
Her condition, Olmsted syndrome, is very rare. This was first described by H.C. Olmsted way back in 1927, and in those basically 100 years, there have only been 73 cases that have been diagnosed. So it is super, super rare, but obviously she's dealing with it today.
My heel is pretty hard. You know, like when you tap on your tooth, you can feel it, but you can't feel it at the same time. That's exactly what what it's like.
So this condition creates an overgrowth of the keratin of the skin. Now the thickening can occur in the soles and the heels of the feet. That's what's called Olmsted syndrome. But some people with a very similar palmoplantar keratoderma also get it in the palms of their hands, and some people can even get it around the mouth. And as you can see, it can be very painful.
Olmsted syndrome has no cure, and it's all from a genetic condition that, people deal with for their entire life.
Olmsted syndrome is basically caused by a mutation in some of the genes that create keratin. And keratin is the part of the upper layer of skin that causes the skin to feel firm and hard. When this mutation occurs, it can cause that keratin to overgrow and get these thick, hard patches like what you're seeing on her feet. Now, the majority of these cases are spontaneous mutations, meaning that there's no family history of Olmsted syndrome, but there are some inherited variants as well. And so some people can inherit this from their parents.
And they came right back. So I take off her sock completely, and the growths are right back where they were.
That's the problem with Olmsted syndrome, is that you get these huge plaques, these huge growths of keratin on the feet, and if you remove them, unfortunately, they grow back afterwards. So how do you treat it? Let's see what this podiatrist does for this patient.
So it's going to be a real challenge to treat her. They just came back
Quick.
like ferocious.
Yeah.
As a plastic surgeon, this kind of reminds me of when we treat keloids. Keloids are scars that grow outside of the normal boundaries of the original scar. And some people say, well, just cut it out and it'll be fine afterwards. No, a lot of times when you cut out a keloid, it comes back even bigger. And that's what can happen here in Olmsted syndrome as well.
This hole right here, that was clear. There was nothing there.
For how long?
A few months, maybe.
Now you may think, oh, you've got a little bit of thicker skin on the bottoms of your feet. How is that going to be a real problem? Well, unfortunately, this can create a lot of pain, and it can make patients who have Olmsted syndrome have a hard time walking. Itching or pruritus is also a very common symptom of Olmsted syndrome or palmar plantar keratoderma.
I would like to address multiple things.
Okay.
Not only get rid of the growths on the bottom of the foot, but also I would like to put a graft on top of them to help try and train the tissue.
That's an interesting thought, in that she's got these large growths. You have to remove them, because if you don't, they're just going to continue to grow. But how do you prevent them from coming back? And so what the good doctor is doing is she's talking about putting a skin graft on top of it to see whether you take different skin on the bottom of the foot and whether that prevents that keratoderma, that hyperkeratosis, from occurring. The problem with skin grafts, though, is that they're very, very fragile, and any kind of shearing of that graft can cause that graft to basically disconnect or fall off of the recipient's site and essentially just die.
My hunt for the secrets of healthy and glowing skin have all led me here, and I aim to find out why. I'll get to the bottom of this skincare mystery.
There's no mystery here. It's just Youn Beauty. Our products are packed with all the necessary ingredients that you need to help hydrate, protect, and revitalize your skin. It's really just that simple.
There's no way it's that simple. I'm on to you, bub.
Check out our online store at younbeauty.com or download the Youn Beauty app on your phone to order yours today.
It's almost wrapping around her pinky toe. So I'm gonna go in with a 10 blade to try and get this down to the healthiest tissue I can get it to and put that graft on.
In people with severe palmoplantar keratoderma, that thickness can actually envelop around a potential toe and can actually disrupt the blood supply of that toe, and people have actually had amputations of parts of their feet after developing this condition and that condition getting out of control.
That's thick skin.
The blade counter out.
Am I-
Can't wait till you get lower.
The heel, yeah.
Now, I'm not a podiatrist, and honestly, feet are not my thing, but that has got to be so satisfying to just lop that thick keratin, that thick skin off of the foot. It almost looks like you're kind of peeling the tempura, that deep fried batter, off of food, either chicken or vegetable, when you're eating it.
I have to actually use the belly of the blade to actually curve in and get all of that where this callus is growing from. Otherwise, I'll never get to the root of it.
Wow, that looks like it's leaving quite a bit of an indentation. You can see with this treatment, there's like zero bleeding. There's no blood supply to that area just because it's just thick keratin that doesn't have actual blood vessels going to it.
How gratifying is that?
Wow.
It actually has like stems from where it's like growing from, right?
Yeah.
The idea of this plaque on the bottom of a foot with little stems growing in reminds me of that show, The Last of Us, where you've got these fungus and they got these little tentacles that go out. Obviously, this is not a fungus. This is a whole different situation. And really, one thing that can be done to help soften that area prior to the surgery is using urea. Not urine, but urea. Urea is a very common ingredient in certain skincare products that can really soften the skin, especially on the sole and the heels of the feet.
It feels so good to actually have it off and look at the actual normal skin underneath. It's quite invigorating.
The difficult part about that is it's so satisfying to remove it, and the foot looks so much better without it. But the problem is with Olmsted syndrome, this grows right back, and therein lies the real challenge here. So let's see how she puts this skin graft on, and let's see how the patient does afterwards. Fingers crossed that it helps to solve her problem.
So I'm washing off the skin graft really quickly. It's the mesh work. It'll go on the bottom of her foot to help let the new skin cells come through here.
So why does this skin graft look essentially like a mesh netting? Well, the idea is that you take skin from one part of the body and then you put it onto another part of the body. And in order to maximize that amount of skin you have, we put it through a mesher, which is a device that does cause it to look like this. That allows you to stretch that skin and cover a much larger surface area. Now, new skin will grow in those holes between the actual skin graft. So essentially, this is a way to maximize a smaller skin graft and make it cover a larger area. And we do this with skin grafts all the time.
I'm gonna check in with my patient, Rebecca. I haven't seen her in a few months since her surgery for Olmsted syndrome.
Do you want to see them?
Yes, if you're okay with that. Oh, look at you. Yes, you can see that it looks like more normal skin.
Well, it definitely looks better, but unfortunately it does look like some of it's growing back. Hopefully as it grows back, it doesn't grow back quite as aggressively.
Nothing is popping off. The heels even look really, really good. I'm super, super impressed.
I'm happy.
Great job to this patient's podiatrist, and I really hope that these results continue to stay with her, as this is a really, really difficult condition. Well, something else that is congenital and super difficult to deal with is when your feet resemble lobster claws.
Huh?
Yes, this guy's feet literally look like lobster claws. How do you walk like that? Let's see how the doctors of My Feet Are Killing Me deal with it on this reaction video right up here. And as always, remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.